Okay, in the interest of everyone's time, I'd like to go ahead and get started today. We know that there will be others that will be joining us as we progress through here. So my name is Charlotte Meisenheimer, and I am the Director of Membership for the Manhattan Chamber. And I'd like to welcome everyone today to our Success in 60 virtual program. Success in 60 is a program that we utilize for education throughout the year for our chamber members and is sponsored by Adair Thurston. Adair Thurston is a full-service legal department, or legal team, I should say. If you have a legal problem, they have a legal solution. Our speaker today is Julie Gibbs, Riley County Health Department Director. A few days ago, the Manhattan Mercury was quoted as saying she is the right person to handle this. Julie, we are so excited that you were able to take the extra time today to be with us. We know that your plate is full and your schedule is extremely busy. So at this time, before I turn it to Julie, just a couple of housekeeping issues. I think everyone is on mute, but we'd like to keep that on mute if we could while Julie is speaking. We would like you to utilize the chat feature if you have questions, and we'll be able to pose those to Julie at the end. So without any further ado, Julie, thank you again for being with us and welcome.
All right, thank you. Thanks so much for having me. I'm going to start off today just to give you an overview of what today looks like in our county and also statewide. The numbers I have for Kansas are going to be from yesterday since I haven't seen an update yet today. We usually get that around 11 or 12, but just haven't seen those come out yet. So I'll give you the numbers and then I'm going to go into the order, specifics about the order, and a few other notes, and then I'll open it up for any questions that you might have. So as of yesterday, Kansas has 5,030 positives statewide. There are now 547 hospitalizations, and there have been 134 deaths in Kansas. Riley County, as of today, is still at 55 confirmed positives. We've had no new positives as of today. We just had a couple in over the weekend. 30 of those 55 are considered recovered. We also have 31 pending tests, and there have been a total of 519 negative tests in the county so far. We still have one Riley County resident in the hospital. There's also one PUI, or person under investigation, at the hospital waiting on test results. As of last Friday, we issued a restricted movement order for Riley County to begin today, the 4th, and expire on the evening of Sunday, May 17th. This is in response to the governor's phased approach to reopen in Kansas. Our goal is to reopen Riley County in a very similar and controlled method. This will certainly be a trickle effect. I've used that term a lot lately, with many restrictions in place. We understand that we need to stimulate the economy and open stores and businesses back up, but we want to do so in a careful way to protect the health and safety of our community. We decided after seeking guidance from Johns Hopkins public health principles and the White House guidelines, and also from input from our two task force, the COVID-19 clinical task force and also the recovery task force, that we needed to be a little more strict than the governor's phase 1 of her reopening plan. In doing so, we're reopening restaurants, but only at 50% capacity. And we are limiting them to a 10 p.m. timeframe, so they will need to close at 10 p.m. This is to distinguish between a restaurant and a bar, and also to reduce the risk of exposure and having too many individuals in at once. We decided that this was necessary because Manhattan serves as a hub for many other counties. As you all know, there are many people that live in Pottawatomie or Geary County or the surrounding counties that work here in Manhattan and spend a lot of their time here in Manhattan or shop here in Manhattan. And there are other people from surrounding counties also that utilize our hospital here. Because of those reasons, and because we have such a unique population here in Manhattan or Riley County, we need to be a bit more restrictive. We did go back and forth a lot on this, but like I said, we had to take into consideration what the guidelines are telling us to do and our unique population here in Manhattan. So we did get input and data from many other sources, and we spent a lot of time on this. We had many different drafts of what our plan could look like, and we spent a lot of time talking to many different people, especially Geary and Pottawatomie County. We wanted input from them as well, what they're seeing in their counties, or what their ideas are. Our plan looks a lot like Pottawatomie County's. It's almost identical actually to Pot County's. As far as what our plan says for restrictions inside the business, or I'm sorry, outside the business, all businesses must put in place controls to ensure that the number of customers inside the store stays at a level that provides for the requirements of social distancing. We've seen a lot of this already happening in businesses that are considered essential that have been open through all of this. And so I think it's working pretty well so far from the stores that I've been in, which is not very many, but I have been in Dillon's and Hy-Vee, and it looks like they have everything marked off and people are adhering to those marks. If there's crowding, please limit the number of customers allowed to enter the business. You may want to staff an employee at the front door, and as one customer leaves, allow for another to come in. Of course, that's dependent on the size of your business. Post signs at the front door informing customers of occupancy limits and prohibiting customers with illness or fever to come in. Inside the business at point of sale registers, you can limit the lines and post signs at each register, urging customers to maintain social distancing. Like I said, we've seen a lot of that in the stores already. Provide shielding between customers and employees at restaurants, or registers rather. We've seen the plexiglass at many of the grocery stores in town. So it seems to work well, but we also encourage to wear masks as well. Post social distancing signs and floor markings throughout the store. Place hand sanitizer available at every open register. Routinely clean the store and have soap and water available in the restrooms. It should already be happening. No waiting areas or lobbies in other areas where customers can congregate. No seating at the bar top, service counters, or related locations. Provide alcohol-based or CDC-approved hand sanitizer for customers and visitors. Require employees to stay home if they're sick. This is very important, and I think this should just come with the communication between the manager and the employees. Making sure to have that all sanitizing products are CDC approved. You can clearly determine that based on their label, and also allow for air dry according to the manufacturer's that label. It's important for the owners or managers to provide ongoing information and training to all employees regarding infection control, cleaning, and use of PPE. And also drinking fountains and customer provided cups or drink containers should be eliminated. As far as information for retail, if carts or hand baskets are provided, place them at the front of the store and clean the handles before bringing them into the store, or providing them to a customer to provide means for customers to sanitize their own carts. Checkout lanes must provide a 6-foot spacing between customers, and no use of reusable bags. There's also very strict guidance for restaurants and food establishments since we are opening those back up. Those include no buffet, salad bar, or self-served unpackaged food. Customers are limited to 50% of the rate of the occupant load based on the fire code. No seating at bar tops, counters, or similar locations. No waiting areas. Maximum of 10 persons at a table with the 6 feet between tables. That's in accordance to the governor's order.
I don't believe so.
Only. That will reduce your cleaning of the menus between every person, which could be very hard to do. So we require disposable menus only. All employees' temperatures to be taken prior to being allowed to work each day with no use of fever-reducing medication. And they shouldn't be above or at 100.4 or above. Anyone handling unpackaged food to wear a mask or a face covering. All tables, seating, condiment dispensers must be sanitized after each use. No live music, dance floors, or entertainment. And all dine-in and seating will close no later than 10 p.m. nightly. That's not to say that you have to have people out of the establishment at 10, but just that it will close at 10. For pet groomers, we've been getting a lot of questions about pet grooming. They can open up their businesses. They just need to meet a few of the requirements, including meet the customers outside, post signs on the door for the customers to wait outside, or just let them know prior to their arrival. And groomers are to use their own leash and collar. Other recommendations, these are just recommendations that I'm going into, include the public wearing cloth masks. We haven't made this a requirement for the public or customers to wear masks, but we strongly encourage it, especially in areas where they're unable to maintain that 6 foot of social distancing. I just say it's a good idea just to wear your mask out in public, no matter where you're going. I know I made a trip to the grocery store on Saturday morning, and even though it was early and there weren't that many people there, I still wore a mask. And really, I saw most people were wearing a mask, and all of the employees were wearing a mask. That was Dillon's East. We say this every day. We strongly recommend wearing a cloth mask when going to a store or a place of business. Also, that hand hygiene is very important. Keeping a hand sanitizer where you can easily access it is a good idea. Soap and water is the best, but a lot of times you don't have soap and water available. So hand sanitizer will do the trick too. For individuals that are high risk, or if they have some underlying health conditions, they're encouraged to stay home. I would even go as far as encouraging those individuals that are at high risk or the elderly to maybe get somebody to deliver those groceries to you, or those things that you need, medication, to your doorstep, so that you can reduce your risk of exposure. We will begin to see the effects of our reopening in the next 14 days. We probably won't see any effect from this week because we know the incubation period is 2 to 14 days, so it can take up to 14 days to start to see those effects. Hopefully we don't see a big increase in our percent positives. That's kind of what we're hoping for, and that's really up to the community and up to the business owners to implement those restrictions and those modifications to their business, which I have no doubt they will. So far, we've done good as a community. I've been really pleased to see the great things that we've done here in the community. The essential businesses that put these methods in place without even really being told to, or that they were just given recommendations, they went as far as doing above and beyond what was asked of them. So I have no doubt that it'll work. We have begun to see an increase in our testing, and we hope to increase it even more as our results from that population health survey come back and we're able to analyze those results. We are going to reach out to those individuals who did indicate they want to be tested and they have at least 2 symptoms. We are also currently testing asymptomatic individuals as they prepare for elective surgery at the hospital surgical center. So you may begin to see a lot more pending tests and hopefully a lot more negative tests because of that. I will say any business with a positive case of COVID, with one of their employees, they will be evaluated on a case-by-case basis. We've already had this happen in a couple of instances. Of course, we do our contact tracing, and we do make contact with those individuals that they've come in contact with. Those businesses who are adhering to the best practices will be much less likely to be impacted. Those choosing not to are going to be at greater risk of being closed. So we may come in and have to close a business if we do see a lot of employees affected by this, or it may be up to the business owner. They may decide, hey, we've had so many people that are needing to be quarantined. We can't run a business like this, because we all know that if you have to be quarantined, it's going to be 14 days at home. So if that's the case, the business might decide to close on their own. Or again, if they're not adhering to those best practices or to the requirements, we may have to go in and close them. I hope that never comes to that, and I don't see that happening, but just in case, we want to make sure that we put that out there. Any case will require a follow-up from the health department, which may also include requirements for additional sanitization of or other practices. So we might require you to close your business even for a day, just to make sure you deep clean. That's going to be on a case-by-case basis. We'll have to analyze that as we go. For the future, we of course are waiting on vaccination. We have not had any indication of when that might be, but we know we have plans in place for when this does become available to us. We also have a plan in place to enhance our testing capabilities even more. We currently have 15 to 20 contact tracers that are affiliated with the health department and have all been trained. And we have the potential of having about 25 more come on board. We are waiting for more testing supplies, but as of right now, we are able to handle the demand. We've had enough test kits from KDHE that we could test about 50 a day. We're currently testing about 20 a day. And that's not just here at our swabbing station. That's from places around town. We do quite a few through our swabbing station, but on average, we test about 20 a day. So right now, we don't have any, we're meeting the demand. We do have enough testing capability, but we know that if KDHE opens up their restrictions a little bit on who's to be tested, their criteria a little bit, then we will be testing more people. So we're currently looking for ways to get a hold of more testing kits. That's something that we do every day here. And we also work with our clinical task force so that they can help us with that. We're still pushing people to our Gmail account. If anyone has general questions about COVID-19, we see about 10 to 15 emails every day come through that Riley County COVID-19@gmail.com account. We also have our screening line. We have about 10 or so callers a day with that. And that is down from when we first started it. We did have about 20 to 30 calling that screening line. That screening line is managed by healthcare professionals, mostly nurses, nurses from here at the health department, and then just nurses that volunteer their time from around the community. We do have quite a few retired nurses. So it was pretty awesome when I put that out to people and how many people just jumped at it and they were ready to get on board with this. And they're not getting paid for that, except for our nurses here that work during their time, they get paid. But the ones that work after hours and on the weekends, they don't get paid for that. So I think that's really cool that they are willing to step up and help with that screening line. So when you call that screening line, it's 785-323-6400. They'll ask you a series of questions, and then based on how you answer those questions, based on your symptoms, they might have you call your primary care provider. If you don't have a primary care provider, they will either have you call KSTAT or Kanza. They do swabbing at KSTAT at their West location. But we'll need to have a provider's evaluation before you do that. So that's how that screening line works. We also have teamed up with the chamber, and they are willing to take a lot of our business questions. So any business owners that has questions about if they're following the correct guidelines, or if they have questions about the requirements or recommendations, they can call 785-776-8829. or email info@manhattan.org to get those questions answered. And we work with them. A lot of our staff here gets a lot of questions still from businesses, so we'll work with those business owners to make this happen. We want to see Manhattan open up again. I certainly do, but we just want to make sure that it's in a controlled manner, and that we have all of the data and input from other groups at our hands when we're making those decisions. So that's all I have. If you have any questions.
We do have a couple of questions. So let's start with, the first one is from Ron Wilson. Dr. Fossey has been quoted as saying that a second wave is inevitable this winter. What protocols will be in place to respond if this happens?
Yeah, we know we're going to see a second wave of this. And so we have our contact tracers in place. We're working on getting more testing capability. That's the big thing. Making sure that we have enough PPE. That's another huge item that we're working at. Those three things are very big, and something that we work on a daily basis. The command staff meets every morning at 9 via Zoom usually, so that we can discuss those issues. We also have the COVID-19 clinical task force meets with us on Sunday evenings to discuss, again, those same things. That meeting's also set up to discuss some things that they're seeing at their practices, what they're seeing more of, what they need help with. So we have those meetings, and then they meet as a group, an executive group, on Wednesday nights as well. So yeah, those conversations are being had to make sure that we are prepared for that second wave.
Great. And I would remind everyone today, if you have questions for Julie, go type those in the chat box. We will get to as many as we can. So our second question is from Ned Seaton. Any suggestions about vacation policy amendments for people who have to be quarantined?
Yeah, that's a good question. So right now, the county has a policy in place that that employees should not travel outside of Riley County. If they do, they are to be quarantined for 14 days, regardless of where they go. Now that's going to let up here after a while, but that's one thing the county has put in place, just because we really, especially with the stay-at-home order, we really didn't want anyone traveling abroad. I would suggest to people, I've had to make arrangements with other arrangements with my travel that was supposed to happen early June. I'm just not going. So I've had to, and luckily my flights I was able to reschedule those anytime within the next year. So I would make other arrangements if you're going to be traveling at least before July. And we don't even know really what it's going to look like in July. So definitely making other arrangements if you can.
Okay. Joe Bruder would like to know could the Riley County Health Department do temperature checks and assessments for company employees daily, since we do not have touch-free thermometers?
Yeah, right now we're not set up to be able to do that. We just don't have the staff that would be able to do that. However, we did put in for some more thermometers. We had a grant that came out that we were able to ask for about $1,000 worth of thermometers. So at least we could be able to give those out to the public. But yeah, right now we're not set up to be able to do that.
Okay. We have LG Style wants to know on recap on business events that can limit to 10 and a strategy of separate entrance and exit methods. So is that what you would recommend at this time, is people are coming in their businesses that they come in one door, go out the other, or how do you suggest that?
Well, so business events, so are you talking about?
It kind of appears that there's two questions. So the first one being, well, I did say business events, I could limit to 10. So no more than 10 group of 10 people.
Right. Yep. No more than 10 people. And you have to make sure, of course, social distancing and all of that is in place. Yep.
Okay. When can art galleries safely open with distancing and restrictions in number of people in the gallery at one time?
Good question. I haven't seen anything specific to art galleries, so I wonder if they would fall in a different category. Yeah, as of right now, no more than 10 at one time. So let me get back to you specifically on art galleries. That's a good question.
And we will make sure that we get that information back to you, and we actually will be able to email everyone out today who is able to join us so that we can answer these questions. So Elaine wants to know, is the governor's order still in effect? We may not know this, staying evictions for residents. If not, does Riley County have any sort of order?
I don't know that, so I'll get back to you.
Okay. Lisa Sisley would like to know, should we shut down our break room except for access to the sink for hand washing? What are your recommendations there?
Yes, I would shut down the break room at least until May 18th.
Okay, perfect. And you had indicated earlier also, Julie, that providing shielding at registers, is that a recommendation or is that a requirement?
It's a requirement to provide some sort of shielding. So if it's a plexiglass or whatever you can come up with that would meet that need. We've seen a lot of places that just provide the plexiglass. I've also seen it hanging from the ceiling as well. That would be I think
like a sheet, like a sheeting, like a clear plastic sheeting from the ceiling.
Yeah,
okay. That can be okay. Perfect. Do you have any other recommendations for large offices, 100 or more, returning to the workplace outside of social distancing? Would you encourage to continue to maximize telework for the time being?
Yeah, absolutely. That's what we've told our employees here. The county doors are still closed to the public for another 14 days. But even beyond that, I'm going to ask that we just keep continuing, if we can, having employees work from home. If we can continue our Zoom meetings, our calls instead of face-to-face. We do a lot of our classes via Zoom now. And if we can continue doing that, at least until June 1, I think that would be advisable right now.
Okay. Are you also recommending that everyone, of course, wears their face mask? So can a business require them to do so, and if such, should they post that on their front door? Would that be the recommendation?
I believe a business could require them to do that, and yeah, they could place that notice up. And just with the face shield or with the face mask, it's just so important that everyone wears them the proper way. That's one thing that I've noticed a lot of. Some people have them right underneath their nose, or they'll take them off when they're talking. So I think there's going to be a demonstration at 1 today with Bob Koppel or some of his employees. So that might be good for people to watch, just so that they know how to properly wear a face mask.
Yes, and in fact, he is joining us tomorrow at our Success in 60, same time, different Zoom number, but still on Zoom, to demonstrate how to properly use your PPE for your employees. So those of you that have not registered for that, feel free to do so today, and we'll be doing that tomorrow again at noon. Waiting room will open at 11:45 and going from noon until 1 or when questions are answered. So thank you. Let's see. Do you foresee requirements for childcare providers staying in line with the gatherings regulations, such as greater than 10 now, then a higher number in phase 2?
Yep. We've talked about, again, this is in coordination with Pottawatomie County, going up to possibly 12 for the next phase. And then of course, beyond that, it'll be like phasing out. So it'll just be the regular requirements as far as KDHE allows.
Okay. Again, I just want to remind everybody, we're kind of winding down on our questions currently. So if you have questions, so please, we got another one, but please keep them in the chat box. Due to licensed cosmetologist fashion designer events to open after COVID lift, majority of the businesses online? Not for sure. Are you, maybe they're asking if, this question. So currently I'm guessing they're asking if the majority of the business should be online now and then open later, possibly.
Yeah, for cosmetologist, fashion designer events. I would, you can get it if you can do them online. Yeah, do them online now. Okay. I don't know if that's really what you're asking. You could clarify.
Yeah, we'll give them a minute to reach out in there. So the questions that others might have. Julie, do you mind while we're waiting if you could give those web addresses and telephone numbers for people, like, once again, so we can get those back out to people for additional.
Sure. Yeah, so general questions, you can email them to rileycountycovid19@gmail.com. And then if you have symptoms and you want to reach out to our screening line, that is 785-323-6400. And then if you are a business that wants more information or guidelines on how to safely open up your business, you can call 785-776-8829 or email info@manhattan.org.
Great. And I will say that those orders are on our website, manhattan.org. They're also on the Region Reimagine website. And we continue, as do you, continue to try to push that information out as much as we can on social media. So, would you suggest a limit to less than 10 people allowed in a space of its smaller space? For example, we have a much smaller lobby. You're actually suggesting lobbies should be closed. Is that correct?
Yes.
Like no lobby.
No lobby. Yeah.
So it might be that businesses will want to reach out to their clients or say, we'll be letting you in one at a time, or such that everybody has to stay out of the lobby areas gathering. Mm-hmm. Okay. Kurt has shared with us that the art gallery is entertainment and will be in later phase to open.
Thank you, Kurt.
For that. Yeah, so I think the event question was just that currently it's limited to 10 per person, just as and with safety precautions, social distancing and stuff in place.
Yep.
So I think they're wanting to confirm that. So great.
Yes.
Okay. And does anyone else have any additional questions for Julie at this time? Elaine, apartment complex, the clubhouse lobby is smaller. I'm keeping it closed. Apartment complex is smaller. Are you suggesting we keep it closed?
Yeah, I guess if it serves more as a lobby, yeah, I would just keep it closed.
And you can maybe put something out, looks like it's such an apartment complex, about appointments, make an appointment to come in and see, or something of that nature. Would that be a recommendation you might have? That might be
Absolutely. Yep.
an easier way to do it, and to make sure everybody's kind of social distancing out. Okay. All right. All right. I am not seeing any additional questions at this time. Oh, as soon as I say that. Huh? Does ours, okay, support asking those who don't follow guidelines to leave the business? That's a good question. If you have someone in your place of business that is refusing to social distance or continues to congregate where you wish them not to, are you suggesting that just ask them to leave?
I get, yeah, as a business owner, you can make that call.
Okay. It's a tough, sometimes it's a tough
I
situation.
know. Yeah.
Again, I think the more people understand on both sides, you know, what's expected and what's happening. We're all about education. So
Yeah.
again, Julie, thank you so much. We know, again, your plate is abundantly full right now. So thank you for taking the extra time to be a part of our Success in 60. And what time will your update be today that people should turn in for?
4:15.
4:15. So we will see you on Zoom at 4:15 then. Thank you.
Yeah, Facebook Live will be on.
Oh, that's right.
Facebook Live. Yep.
I apologize.
Thank you for having me.
Absolutely. Thank you to everyone who is on today, and a special thank you to Adair Thurston as our Success in 60 2020 sponsor. So be sure to check out all of our websites and continue to monitor us on social media as we all reopen in Manhattan. Thank you.
Thanks.
Thank you.